with the team we've put together, we often find ourselves helping each other across our service area to provide the best programs and services.
Hello, my name is Blake Furman. I'm the founder and executive director for Veterans Navigation Network. We're based in Billings, Montana and have an office here as well as in Miles City, Montana, and we serve veterans across the state of Montana and beyond. Our goal is to connect veterans to the benefits and resources that they've earned through their service, and through that work we get the opportunity to meet a lot of great organizations doing great things for the people here in Montana. And I'm here today with one of those individuals who works for Living Independently for Today and Tomorrow, short for LIFTT, or long for LIFTT. And with me is Jed, so thanks for being on the show today, Jed.
Thanks, Blake.
Yeah, well, tell our viewers a little bit more about yourself and about how you got to work with LIFTT.
In terms of myself, I'm the Public Relations and Independent Living Specialist at LIFTT. I've been in that role for almost 16 years. I was born in Idaho and lived some other places as a child, but was largely educated here in Billings, and including MSU Billings. And again, after a few false starts, I ended up at LIFTT in 2010. Again, LIFTT is a non-profit, what is called a Center for Independent Living, meaning we are a hub of resources, advocacy, programs, and services for people with disabilities of all ages and all types of disabilities. And all of our programming is centered around the idea that persons with disabilities can and should live integrated in their communities as independently as possible. And as a person with a disability, I was born with cerebral palsy and also on the autism spectrum. That sort of mission spoke to me as I was looking for work in the communications and advocacy field.
Yeah, well, that's awesome. I appreciate you sharing a little bit of your story. And so, I mean, that lived experience is a huge piece of what we do with Veterans Navigation Network, having that peer connection through the veteran-to-veteran aspect, but we can't do it all and be it all for every veteran, so that's where we really try to rely on community partners like LIFTT in getting vets connected to other resources out there outside of, there's just a lot outside of the VA that people don't know about, like LIFTT. And so can you talk a little bit more about your guys' direct services?
LIFTT has quite a few programs and services under its umbrella, seemingly ever growing. One of our main programs is the Independent Living Program. There are 6 core services within independent living. There are 400 independent living centers across the country, each under different names, each serving a different section of the country. There are 3 other IL centers here in Montana, and but all independent living centers provide the core services of information and referral, peer support, skills training, self-advocacy, youth transitions, which is helping youth ages from about middle school onward, helping youth with disabilities find the transition from K-12 education to whatever comes next, whether it's the higher education or in some cases even the armed forces. not all disabilities are automatically disqualifying from service or into the world of work. And then institutional transitions, which means the transition of people from living in institutional settings such as nursing homes, hospitals, rehab facilities, state-run and federally run facilities like Warm Springs. And so again, those are all services that LIFTT helps provide. But one of the things regarding independent living services is that each person who comes to us is a different person, and their different experience, and so how we provide those services sort of varies. I personally help a lot of folks apply for Social Security benefits, which is a bit of a process. I'm not sure I don't envy you guys tackling the VA paperwork, but it's still a bit of a process. And again, what I do is I sit down with people and I help guide them through it. Again, independent living, again, we believe in, the old, I don't know if it's Benjamin Franklin or Aesop or who said it, but teach a man to, give a man a fish he eats for a day, teach a man to fish, he can feed himself for the rest of his life, or in Montana, he's got an expensive habit.
Yeah.
But anyway, and that, and again, we really do work with the folks to sort of not only give them the services they need, but leave them with some sense that they've gained a skill, whether it's just the confidence. I talked with a woman this morning who was, a little fearful of making a phone call to check on something with the Social Security Administration, and we talked about it. And again, she made the phone call and found out that, manner of speaking, everything was going just fine with her case. So,
yeah, people. Whether you're talking the VA, private
Right.
practices, we're lucky to have 3 different really big health systems here in Billings, but people are their own best advocates.
And again, that's the independent living centers were founded out of the disability rights and independent living movements, and which all sort of grew out of the larger civil rights movement that sort of took hold in the middle of the 20th century. But sort of the introduction moment for the disability rights movement was the 504 sit-in in San Francisco in the mid-70s, just to get the government had passed a law called the Individuals with Disabilities in Education Act, and Section 504 was said that all federal refunded programs should be accessible to people with disabilities. The Fed passed that law in 72 or 73. It was 76 or 77, and they still hadn't drafted the regulations for it. And so that led to a sit-in where disability rights advocates occupied the federal building in San Francisco for quite a long time. I don't remember exactly how many days. It's a record. Or close to a record. Again, there are some occupations in the American Indian movement that may have lasted longer, but and so again, all of our services are built with that idea of enhancing or focusing and enhancing the independence of the person with disabilities. And so again, we help people find resources to obtain vehicle adaptations and durable medical equipment that for some reason insurance, public or private, doesn't cover, or things like home modifications. We help folks again learn the sort of the systems and the processes to find the resources such as grants and other funding. Again, in addition to the independent living program, we are a provider through the Montana Vocational Rehab program. Again, clients, as I understand it, vocational rehabilitation clients, again, they get to a point where they're ready to do some of the job search and the work site stuff. They have a choice, at least in Billings, they have a choice to work with a couple of different agencies, and LIFTT is one of those agencies. And so we again help both youth and adults through VR and the pre-employment transitions program, which is also administered by VR, which is for high school age youth who are still in school, to give them a taste of the work world and see if, before they commit to, before they leave high school and say, oh, this is the job I want, and then they find out they don't, whether it's committing to college for it or trade school or just even trying it out.
Sure.
We also have a relatively new program called Money Follows the Person. Again, that LIFTT is a state, contracts with DPHHS for that. Money Follows the Person is a Medicaid program, and again, what it's designed to do is help folks who've been institutionalized return to a community-based living setting. So we've transitioned a number of individuals. Again, we've only been doing this less than a year. We've transitioned quite a few individuals from living in nursing homes and other facilities into either assisted living or into their independent apartment, and made sure they had the programs and services they needed to make that as successful as possible. And we also are, through Medicaid, a provider of self-directed personal care assistance services, PCA also. And again, all of the consumers on LIFTT services are for standard Medicaid eligible. There are different, and I'm no expert on this, but there are different types of Medicaid, and to be eligible for PCA services, you have to be on standard Medicaid. And again, one of the things we often do as a preliminary in our IL department is help people sign up for Medicaid, because they come to us interested in PCA services, and the PCA team does their check, and and we're often able to find a way, particularly if somebody is still working. There's Medicaid for workers with disabilities, which again greatly reduces the amount of spend down a person has to a cost share fee based on a income rubric. And so again, and one of the unique things about our PCA program is it's self-directed, is that LIFTT and our wonderful PCA program facilitators serve as, sort of compliance assistants, and they check and make sure everything's going as it's supposed to. Again, Medicaid's got rules and regulations to rival the Army. So but in a self-direct situation, the consumer or their personal representative, again, sometimes is responsible for the hiring and the training and the setting the schedule for their caregivers, so that if you go with an agency-based program, you get your worker comes at 8 a.m. and you get your bath at 8:15, and again through self-direct, again it's another way that people with disabilities can assert independence, that they take ownership and responsibility for finding their PCAs, and and maybe the by the book way to do a task, because again PCA services are all about helping people with tasks of daily living, is not the way a person needs or wants it done, but so that the person who's having that task or being helped with that task is the one who says, this is how I'd like to do it. Again, and that's a Medicaid program we again through the state of Montana and the federal government, obviously through Medicaid. We also have a growing health and wellness program through a number of grants and contracts, again state, federal, and private. The health and wellness program features Tai Chi classes. They provide diabetes prevention. I see those words in print all the time, and I get them confused. Diabetes prevention program, again through the state of Montana. We are a provider of that, and that is a year-long journey that those folks undergo to, if you're pre-diabetic and want to not go over that line, or at least do your best not to. Sometimes it's out of folks' hands, but again it's a year-long. Again, it starts with weekly sessions and then it tapers off, but it's quite a commitment. And we also have the Decide program, which is diabetes management for folks who are diabetic. Teaches them how to manage their diabetes. We also have a Walk with Ease program for, again, it's through the Arthritis Foundation, but anyone who's looking to get out there and do some walking and do it, with an eye towards being safe and sound, would benefit from Walk with Ease. And again, our service area is 18 counties in southeastern and south central Montana, all the way from Richland County and Webo County and Fallon County there on the Dakota line, to Dawson County and Custer County and Carter County and I'm trying to think. Carbon, Bighorn, Stillwater, Golden Valley, Garfield, Yellowstone, obviously, and we have offices in Glendive and in Billings. Again, we sort of have a line where folks are served by the Glendive office or folks are served by the Billings office. But again, with the team we've put together, we often find ourselves helping each other across our service area to provide the best programs and services. We do our best, particularly with things like classes, to offer them not only in person but online through Zoom and Microsoft Teams. That way, because again, budgets don't stretch as far as we'd all like, so traveling and gathering in all of these different communities can be difficult, but that's one place the virtual seems to help, and we're able to connect. We have a peer program, which we look for folks who are interested in gaining some skills and some experience in the work world to volunteer with us. And we have a handful of peers right now, but we're always looking to grow and expand that program. Tanya Thomas is the leader of that program, again, and
Are those peers also in those other counties, or are they primarily in Billings and Glendive?
Primarily in Billings and Glendive. We're, again, like I said, we're open to expanding it. Can't speak to how all of that would work, but
Sure.
you know, we're out, and then we are in the process of, and it's a somewhat lengthy process, of developing a rural ADA or rural accessible ADA or rural ADA accessible transportation program, which we're calling RideWell. And that'll be based out of the Glendive office. And the Glendive office is actually going to move soon from its current location on Kendrick Avenue to the former KXGN building in Glendive. Part of the reason is that there's room there to house the RideWell vehicles. We have 2 vehicles through the state of Montana Department of Transportation, one of their capital grants. And we had a grant from the Aging and Disability Transportation Resource Center to do a lot of the early planning work, which has been done, and then we have the vehicles, and now we are sort of in the home stretch of raising some funds. We've had some great community partners step up, like Stockman Bank and the Glendive Medical Center. But you know, we're always looking for more. You guys know how that is.
Yeah. What kind of transportation will it provide to medical appointments?
Yeah, at the beginning, the focus will be helping fill in the gaps that exist in our eastern and rural counties. Again, we have some rural counties closer to Billings, but particularly the eastern rural counties we serve. Getting folks to medical appointments in, as I understand it, you know, the cancer treatment is often is at Sydney Medical Center, and dialysis is down at Holy Rosary in Miles City, and you know, people need to come to Billings or at times. So again, the focus at the beginning will be largely getting folks to their medical appointments, but we're always looking to again expand that in line with our mission to help people live, you know, help people achieve live as independently as possible. And there are other, you know, one of the things we've learned in this is, in addition to medical appointments, there are other needs that might be met through this transportation program, but for right now it's largely focused on the medical. And again, we look forward to being able to launch that in the near future.
Yeah. Do you have, or does LIFTT have specific programs available to veterans, or is there a program that you see being used more by veterans in Montana?
Again, I've helped personally some veterans apply for Social Security, which again can be interesting because they may already be on veterans benefits, or I send them to you guys or somewhere else to learn more about veterans benefits. Again, all of our programs are open to the entirety of the disability community. And again, one of the things we want to do is sort of, again, there are obviously reasons why veterans congregate together, and we respect and honor that, but we want to make sure that we're not excluding veterans from the wider disability community. We've in the past, when we were more intensively involved in helping with home modifications, we helped veterans access VA funding for home modifications. But again, we're sort of a shift in how we do things. We're not as intensively involved in that. We still help people locate resources and provide guidance, but we're not as intensively involved in that process anymore. But again, if you're wondering about home modifications and want to start somewhere, start with LIFTT, and we'll point you in the right direction. But again, all of these programs, sort of the common running theme through them is independence, right. and to help people with disabilities and live as independently as possible and integrate themselves into the homes and communities of their choice.
Yeah. Well, it's very important work, and I think a very common misconception is that every veteran of our military is eligible for VA benefits, and that's not the case. And so for those that maybe can't access VA healthcare or are not able to access veteran disability benefits, then any veteran obviously could use your guys' services if they had that disability.
Yep.
And that's hidden or visible.
Yep.
Disabilities.
Any age, any disability.
Yeah. And so, great service that you all provide, and open to anybody, not just veterans. So I really appreciate you being on the show today, Jed, and giving us the overview of LIFTT, Living Independently for Today and Tomorrow. And for those of you that are watching, if you want to connect with LIFTT or are curious about other veteran benefits or other resources in our community in our great state of Montana, then please reach out to us at Veterans Navigation Network. Veteransnavigation.org is our website, and we share a lot of events and happenings for veterans and their families and the community there. But it's also a great place to reach out to us and connect to organizations like LIFTT to see how they can help you. So thanks again for being on, and we'll see everybody next time.